After more than 4 decades of practicing medicine, I've learned something that still surprises many of my patients. It's not always the loudest symptoms that worry me the most. Sometimes, the greatest threats to your health are completely silent. I've met people in their late 60s and 70s who told me they felt perfectly fine. They were walking every morning, enjoying time with their grandchildren, and living what seemed to be healthy lives. Then, during a routine checkup, a single blood test revealed something they never expected. Not cancer, not a heart attack, not a stroke, but a hidden warning that their bodies had been quietly struggling for years. The most surprising part? Many of them had already taken this blood test before. The number was sitting right there on the lab report, but no one had ever explained what it actually meant. Today, I want to change that, because if you're over 60, understanding this one blood test could help you have a more informed conversation with your doctor about your health and the lifestyle changes that may reduce your risk of future complications. This test is called HbA1c, and although millions of people have it checked every year, very few truly understand what it's telling them. When I first started practicing medicine, diabetes was certainly common, but it wasn't nearly as widespread as it is today. Over the years, I watched waiting rooms slowly change. More patients were arriving with fatigue they couldn't explain. Others complained about blurry vision. Some noticed their wounds were taking longer to heal. Many believed these were simply signs of getting older. But quite often, aging wasn't the whole story. Behind these seemingly ordinary complaints was a pattern that could often be seen long before serious symptoms appeared. That's why I eventually stopped looking at blood tests as just numbers on a page. Instead, I began seeing them as pieces of a much larger story. Every result was a clue. Every trend mattered. And among all the tests I reviewed over the years, HbA1c became one of the first numbers I paid close attention to. Not because it predicts everything, and certainly not because it provides all the answers, but because it often gives us a clearer picture of how your body has been handling blood sugar over the past 2 to 3 months. Unlike a single blood sugar reading taken one morning, which can change depending on what you ate or whether you were fasting, HbA1c reflects a longer-term average. That makes it a valuable tool for helping doctors assess blood sugar control and identify people who may be at risk for diabetes or its complications. Unfortunately, many people don't realize its importance until after problems have already begun. I've had patients who told me, "Doctor, nobody ever mentioned this number before." Others admitted they had seen it on every lab report for years, but assumed that if no one called them urgently, everything must be fine. It's an understandable assumption, but medicine doesn't always work that way. Some conditions develop quietly, very quietly. Blood vessels can slowly become damaged. Nerves may begin to lose function. The kidneys can become less efficient. Vision may gradually change, and all of this can happen long before someone feels seriously ill. That's why today's conversation isn't about creating fear. It's about understanding, because knowledge gives you something incredibly valuable: the opportunity to ask better questions, to notice changes earlier, and to work with your healthcare provider before small problems become much larger ones. In just a moment, I'm going to explain exactly what HbA1c measures, why many people misunderstand it, and what different ranges may mean when interpreted by your healthcare team. Later in this video, I'll also share one patient story that completely changed the way I discuss this test with adults over 60, and the simple lifestyle adjustments that for some people made a meaningful difference over time. Because sometimes, the most important number on your blood test isn't the one you think it is. Now, before we go any further, let me explain HbA1c in the simplest way I can. Imagine that every time sugar enters your bloodstream, a tiny portion of it sticks to your red blood cells. The the more sugar that's circulating over time, the more of it attaches. Since these red blood cells typically live for about 3 months, HbA1c gives your doctor an estimate of your average blood sugar during that period. It doesn't just tell us what happened this morning or after last night's dinner. Instead, it helps reveal the bigger picture. That's why doctors often use HbA1c to help diagnose diabetes, monitor blood sugar control, and identify people who may be at increased risk of future complications. Like any test, it has limitations and isn't appropriate in every situation. But for many adults, it's an extremely useful piece of information. When patients first hear this, they often say something like, "But doctor, my fasting blood sugar was normal. Doesn't that mean everything is okay?" Not necessarily. A fasting blood sugar is like taking a single photograph. It captures one moment in time. HbA1c is more like watching a movie. It gives a broader view of what's been happening over weeks and months. That difference matters. I've seen patients with normal fasting glucose levels whose HbA1c suggested their blood sugar had been running higher than expected over time. I've also seen the opposite. That's exactly why healthcare professionals look at the complete picture instead of relying on just one number. Now let's talk about the ranges. In general, an HbA1c below 5.7% is often considered within the normal range. A result between 5.7% and 6.4% may indicate prediabetes, meaning blood sugar is higher than normal but not yet in the diabetic range. An HbA1c of 6.5% or higher, confirmed with appropriate medical evaluation, may support a diagnosis of diabetes. But here's something I want every viewer to understand. They're not a judgment. They're not predictions of your future. They're simply information. Information that helps you and your healthcare provider make better decisions. Some people hear the word prediabetes and immediately panic. Others ignore it completely. Neither reaction is helpful. What matters most is understanding what the result means in the context of your overall health, your symptoms, your medical history, and your doctor's advice. Unfortunately, over the years, I noticed another pattern. Many people didn't ignore HbA1c because they didn't care. They ignored it because they felt perfectly fine. And that's what makes this test so important. Blood sugar problems often develop gradually. Your body is remarkably good at adapting. It compensates for months, sometimes even years, before obvious symptoms appear. That's why people are often surprised when they're told they have diabetes or prediabetes. I've heard that sentence hundreds of times, and it always reminded me that feeling well doesn't always mean everything inside the body is functioning as we hope. Let me tell you about one patient I'll never forget. I'll call him Mr. Harrison. He was 68 years old when I first met him. Every morning he walked his dog for nearly an hour. He wasn't overweight. He rarely ate desserts. He had never smoked. In many ways, he looked like the picture of good health. He came to see me for something entirely unrelated, a persistent shoulder pain after doing some gardening. During his routine blood work, his HbA1c came back slightly higher than expected. Not dramatically high, just enough to catch my attention. When I mentioned it, he smiled and said, "Doctor, that's probably nothing. I feel great." And to be honest, I understood why he thought that. He had no major symptoms, no excessive thirst, no frequent urination, no unexplained weight loss. Nothing that people commonly associate with diabetes. But the HbA1c suggested his body had been dealing with elevated blood sugar for quite some time. Instead of rushing into conclusions, we sat down and talked. We reviewed his diet in detail. We discussed how often he moved throughout the day, not just during his morning walk. We talked about sleep, stress, family history, portion sizes, and something unexpected became clear. Although he walked every morning, he spent nearly the entire rest of his day sitting. Long hours reading, watching television, working on hobbies. His meals were healthy overall, But the portions had gradually become larger over the years, and sugary drinks had quietly found their way into his daily routine. None of these habits seemed dramatic on their own. Over the following months, working closely with his healthcare team, he made several lifestyle changes. He became more active throughout the day, adjusted his eating habits, and continued regular medical follow-up. At his next review, his HbA1c had improved. Not because of a miracle, not because of one special food, not because of an internet shortcut, but because small, consistent changes added up over time. That experience stayed with me. It reminded me that lab results aren't there to frighten us. They're there to guide us. Sometimes they offer reassurance. Sometimes they highlight an issue that deserves attention. Either way, they're tools, not verdicts. And in the next part of this video, I'm going to explain why HbA1c is only one piece of the puzzle, the common mistakes people make after receiving their results, and the practical habits that can help support healthy blood sugar as we grow older. When patients received their HbA1c results, I noticed they usually fell into one of three groups. The first group became frightened, the second group ignored it completely, and the third group made a mistake that was much harder to recognize. They focused on lowering a number instead of improving their health. That may sound surprising, but there's an important difference. As doctors, we don't treat laboratory numbers in isolation. We treat people. A blood test is a tool that helps us understand what's happening inside the body. But it's only one piece of a much larger picture. Age, blood pressure, kidney function, cholesterol, weight, sleep, physical activity, family history, all of these pieces matter. That's why I always encourage my patients to think of HbA1c as a conversation starter rather than a final answer. Now, let me share something else I observed over the years. Many adults over 60 believe that developing high blood sugar is simply an unavoidable part of aging. They'll say, "Doctor, I'm getting older. Isn't this just normal?" The truth is more complicated. As we age, our bodies naturally change. We tend to lose muscle mass. We may become less physically active. Our metabolism can slow. Some medications can also influence blood sugar. These changes can make it easier for blood sugar to rise. But growing older doesn't automatically mean developing diabetes. Healthy habits still matter. Sometimes very small daily improvements can make a meaningful difference over time. That's one of the most hopeful lessons medicine has taught me. I watched patients in their 70s improve their health by changing routines they had followed for decades. Not overnight, not through miracle supplements, not through internet trends, but through steady, realistic changes supported by their healthcare team. Because it reminds us that it's never too late to improve the direction we're heading. Whenever someone had an HbA1c result that concerned them, I rarely started by asking, "What did you eat yesterday?" Instead, I asked something much simpler. Walk me through a normal day, from the moment you wake up until the moment you go to bed. That's when the real story usually appeared. Breakfast skipped, hours spent sitting, sugary drinks that had quietly become a daily habit, late-night snacks, poor sleep, little moments that didn't seem important on their own, but together formed a pattern. Medicine often works this way. Major health problems are frequently built from dozens of small decisions repeated over months or years. The good news? The same principle works in reverse. Small, healthy decisions repeated consistently can gradually move your health in a better direction. One of the biggest misconceptions about blood sugar is this: I'll know if something is wrong. I wish that were always true. Unfortunately, many people with elevated blood sugar feel completely normal for years. That's one reason regular health checkups are so valuable. They're not about looking for illness where none exists. They're about identifying potential problems early when there are often more opportunities to address them. Think about your car for a moment. Most people don't wait until the engine stops working before checking the oil. They perform maintenance because preventing a problem is usually easier than repairing one. Our bodies deserve the same attention. An HbA1c result doesn't predict the future with certainty, but it can provide an early clue that it's time to have an informed discussion with your doctor about lifestyle, further testing, or treatment if needed. The quiet effects of persistently high blood sugar. When blood sugar remains elevated over a long period, it can contribute to damage in small blood vessels throughout the body. These tiny vessels help nourish some of our most important organs. That's one reason healthcare professionals pay close attention to long-term blood sugar control. Over time, persistently elevated blood sugar may increase the risk of complications affecting the eyes, the kidneys, the nerves, the heart, and the blood vessels. These complications don't happen overnight. They're usually the result of years of uncontrolled blood sugar combined with other risk factors. That's why understanding HbA1c isn't about fear. It's about giving yourself the chance to act earlier rather than later. And in the next section, I'm going to show you the practical habits that consistently made the biggest difference for many of my patients. Not miracle cures, but realistic changes that supported healthier blood sugar over time, while fitting into everyday life. Now here's the part that gave many of my patients hope. An HbA1c result is not simply a number to worry about. It's feedback. It tells you where your body has been over the last few months. And while we can't change yesterday, we can often influence tomorrow. Over the years, people would ask me, "Doctor, if my HbA1c is higher than it should be, what should I do first?" They expected me to recommend an expensive supplement, a miracle diet, or some secret medical breakthrough. Instead, I usually smiled and said, "Let's begin with the things you do every single day," because that's where lasting progress almost always starts. Habit number 1, move more throughout the day. One of the biggest surprises for many of my patients was learning that a single morning walk doesn't always offset sitting for the rest of the day. Imagine someone who walks for 30 minutes every morning, but then spends the next 10 hours sitting, watching television, reading, driving, or working at a desk. They're still getting the benefits of that walk. But long periods of sitting can have their own effects on the body. That's why many health professionals encourage regular movement throughout the day, even if it's just standing up, stretching, or taking a short walk every hour. Small bursts of activity can add up over time. For some people, these changes become easier to maintain than trying to commit to long workouts they eventually give up. Habit number 2, pay attention to portion size. One lesson I learned after decades in medicine is that many people don't eat unhealthy foods all day long. Instead, they simply eat more than their bodies need. Portion sizes have quietly increased over the years. Restaurant meals are larger. Snack packs are larger. Even the plates we eat from are often larger than they were decades ago. Without realizing it, we can consume hundreds of extra calories every day. When I worked with patients who wanted to improve their HbA1c, we often started by looking at portions before eliminating entire food groups. Sometimes that alone made a meaningful difference. Habit number 3, don't underestimate sleep. This is one that often surprises people. Sleep isn't just about feeling rested. Poor sleep can affect hormones that influence appetite, energy, and blood sugar regulation. Now, everyone has an occasional bad night's sleep. That's perfectly normal. But as poor sleep becomes a long-term pattern, it's worth discussing with your healthcare provider. Improving sleep won't solve every health problem, but it's an important part of overall well-being. Habit number 4, review your medications. Another important conversation involves medications. Some medicines can influence blood sugar levels. That doesn't mean they're inappropriate or should be stopped. Far from it. Many medications are essential and should only be changed under medical supervision. But if your HbA1c changes unexpectedly, your doctor may review your medications alongside other factors to understand the bigger picture. Never stop or change a prescribed medication without first speaking to your healthcare provider. Habit number 5, don't chase quick fixes. This may be the hardest advice to hear. Every week, It seems there's a new product claiming to reverse diabetes overnight or normalize blood sugar in days. If those promises were true, my colleagues and I would have been recommending them years ago. Real medicine rarely works that way. Meaningful improvements usually come from a combination of appropriate medical care, sustainable lifestyle changes, and regular follow-up. It may not sound exciting, but it's honest. And in my experience, honesty has helped far more patients than hype ever could. A final thought before we continue. Throughout my career, I noticed something remarkable. The patients who achieved the best long-term outcomes weren't necessarily the ones who made the biggest changes overnight. They were the ones who made small, realistic improvements and kept going. One healthier meal, one extra walk, one better night's sleep, one follow-up appointment, month after month, year after year. Those small decisions often became the foundation for healthier aging. In the final part of this documentary, I'll explain why HbA1c should never be viewed in isolation, the other health markers your doctor may consider alongside it, and the lesson I hope every adult over 60 takes away before their next routine blood test. As we come to the end of today's conversation, I want to leave you with perhaps the most important lesson I learned during my years as a physician. Medicine is rarely about one number. It never has been, and it never will be. One of the biggest mistakes people make after receiving any lab result is believing that a single test defines their health. It doesn't. Your HbA1c is an important piece of information, but it's only one chapter in a much larger story. Whenever I reviewed blood work with a patient, I wasn't looking at HbA1c alone. I wanted to understand the whole person. How was their blood pressure? How were their kidneys functioning? What did their cholesterol look like? Had their weight changed? Were they sleeping well? Were they staying active? What medications were they taking? Had they noticed any new symptoms? Each answer added another piece to the puzzle. Because medicine isn't about finding one magic number. It's about understanding patterns. And patterns often tell us much more than any individual result ever could. The conversation I hope every senior has. If you're over 60, I hope your next routine appointment is different. Instead of simply asking, "Doctor, are my blood tests normal?" Try asking questions like, "Can you help me understand what my HbA1c means in my situation? Has this number changed compared with last year? Are there lifestyle changes that could help improve my overall health? Are there any other tests I should understand alongside this one?" Those questions create meaningful conversations, and meaningful conversations often lead to better decisions. Remember, healthcare works best when it's a partnership. Your doctor brings medical training. You bring your daily experiences, your concerns, and your goals. Together, those pieces create a much clearer picture than either could alone. If you've watched this video hoping to find one miracle blood test that predicts your future, I'm sorry to disappoint you. Medicine simply doesn't work that way. But if you've watched because you want to understand your health better, then I hope you've discovered something much more valuable. Knowledge. Not fear, not panic. Knowledge. Because knowledge helps you ask better questions. Knowledge helps you notice changes earlier. Knowledge helps you work with your healthcare team before small concerns become larger problems. Over the years, I found that patients who stayed curious about their health often felt more confident, not because they knew every answer, but because they understood the importance of paying attention and seeking guidance when something changed. Growing older doesn't mean giving up. One of the greatest privileges of my career was caring for older adults. They taught me that healthy aging isn't about chasing perfection. It's about making thoughtful choices, one day at a time. I've met people in their 70s who became more active than they had been in years. I've seen patients in their 80s improve their eating habits. I've watched people make meaningful changes after decades of following the same routines. These stories reminded me that age doesn't erase the possibility of positive change. It simply changes how we approach it. Progress doesn't have to be dramatic. Sometimes it's choosing water instead of another sugary drink. Sometimes it's taking a short walk after dinner. Sometimes it's finally scheduling that overdue checkup. And sometimes it's simply asking your doctor, "Can we go over my blood test together?" Those small actions may not seem extraordinary, but repeated over months and years, they can contribute to healthier habits and better informed healthcare decisions. A personal reflection. As I look back on more than 40 years in medicine, I don't remember every prescription I wrote. I don't remember every diagnosis I made. What I remember are the conversations, the relieved smile of a patient who finally understood their condition, the family who felt empowered because they knew what questions to ask, the quiet satisfaction of helping someone make sense of information that had once felt overwhelming. That's why I continue sharing these lessons today. Not because every test changes a life, but because understanding our health can change the way we care for ourselves. And that's something worth talking about. If today's discussion helped you better understand what HbA1c measures and why it's an important part of many routine health assessments, I hope you'll share this video with someone you care about, perhaps a parent, a sibling, a friend, or anyone over 60 who may benefit from understanding their lab results a little better. And if you'd like to learn more about healthy aging, medications, nutrition, mobility, and the medical lessons I've gathered throughout my career, I invite you to join me here on Dr. Julian's Journal. Thank you for spending these moments with me. Until next time, take care of yourself, and never underestimate the value of understanding your own health.